lot of interest, certainly amongst our viewers. Let's find out a bit more, talk through some of its potential impacts of this new test with Mustafa Djamgoz, who's a professor of cancer biology at Imperial College. Professor, a very good morning to you. On the face of it, this looks like one of those areas of science where you've got a breakthrough where a test, in this case, a sniffing device used to sniff explosives at airports has been reapplied in a completely different direction and actually now appears useful in detecting the smell of cancer, lung cancer, if I can put it that way, in human beings. How much credibility do you give it?
I think it is quite credible, and I think it is quite important. And as you rightly pointed out, the history of this development is in cancer sniffing dogs. It's been known for a while that dogs can sniff out cancers, not just lung cancer, but prostate cancer, anything that will produce a chemical change in urine, for example. So once the phenomenon was demonstrated biologically, then it became a matter of time before it could be put into a physical device, and hence we're now looking at an electronic nose. I think both the idea, the concept, and the practicality are quite real. I should add that when normal tissue turns cancerous, 200 to 300 genes change, and these have their own products, and part of these products are changes in the levels of the so-called volatile organic chemicals. And now, these are very early events in the cancer process. We're talking about the initial genetic changes, and one of the big problems in cancer management is early detection.
Yeah.
So if we can detect these early biochemical changes, however, including with this new device, then it will be of great help.
Because that's borne out completely by the statistics, isn't it? When you consider that, for instance, the survival rates for a grade 1 lung cancer diagnosis are 75% over 5 years. If it's a stage 4 we're talking about, that shrinks to 5%. So, as you say, detecting those subtle genetic variations, absolutely critical for early diagnosis.
Absolutely, and with things like small cell lung cancer, which is smoking related, these are so aggressive cancers that by the time they're detected through existing clinical methods, the cancer will already have spread, whereupon treatment becomes very, very difficult, and you are fighting against very severe odds. So to be able to detect the possibility that cancer is developing at such an early stage is great news.
Yeah, it just seems so stunningly obvious, doesn't it, when we think about how many hundreds of millions of pounds are spent on the proving diagnoses of different types of cancer, and this seems such a simple solution. As you point out, it's something we've known about for years. We see it in dogs. It's just surprising it's taken us this long to get here.
Well, if you look at the history of science, I'm afraid you will see that some of the best discoveries are simplest. So, if you're a good scientist, you try and keep it simple, you try and develop it into a testable hypothesis or a testable device, and at the end of the day, the evidence will speak. And I think here, the evidence increasingly looks good. It's good news, actually. Not to be able to just detect cancer early. You could do this in a clinic, say, with a similar device, but to be able to do it, with your phone in your pocket, is even better. And of course, it's not just the initial diagnosis, say, it's also monitoring the effectiveness of therapy. So you'll be able to use these devices continuously to see if your treatment is working, almost on a day-to-day basis, if desired.
Wow, that really could be a breakthrough, couldn't it? Professor Djamgoz, thanks very much indeed for your time this morning. Thanks a lot.